There's nothing convenient about facing the fact you are not fit, vulnerable, or overweight. Our addiction to the consumption of soundbite science, published studies, and hanging our health on the words of the latest online gurus without thought, curiosity, or questioning is the mental equivalent to running into the 7-Eleven for that hot dog, big gulp, and a bag of chips. Like the athletes I work with, you have to trust yourself. They trust their own experiences from using Vespa and becoming fat adapted. We live in an interdependent world. In many ways, this is a great thing as it has enhanced our lives in so many ways. The very ability for someone like me, someone with limited resources and a radically different approach to health and performance, that ability to reach a global audience is a perfect example. Amazing, isn't it? On the other hand, this reliance on other people and entities has led to a level of dependence I am not so sure is healthy on a number of levels. And while technology and specialization have improved our lives in so many ways, the unintended consequence has been an ever-growing addiction to convenience of thought, or, more appropriately, a lack thereof. It's like running into a convenience store for a soda, snack, or coffee for that quick fix compared to the hunting, gathering, raising, or growing of our own nourishing food. There is a world of difference. But where I am going here is this. No matter how good the information or advice, how succinctly it is delivered in soundbite science, how many double-blind, placebo-controlled, peer-reviewed studies, or how many followers, you are ceding your sovereignty when you get this addiction. Whether you surrender to the party line of your political, religious, ethnic, gender identity, sport, dietary, cultural, tribal affiliation, or a government policy on the latest crisis du jour, or buying that new car or SUV with the leather seats, sound system, GPS, big gulp-sized cup holders, you are willingly surrendering your free will. And on top of that, most people gladly pay to do so. But I get it. Most of us can't turn completely back to an ancestral or bucolic life, so we have to find that balance in spite of the allure of the conveniences of modern life. We need to balance what we let go of to convenience and where we need to retain our sovereignty. The modern world is exceedingly complex, but the fundamentals are quite simple. Let's use powered flight as an example. The same principles of flight apply whether you are flying a J3 or a 747. But the latest models of jet use complex autopilot systems that essentially take the control of the aircraft away from the crew, whereas in a J3, the pilot has to fly the airplane. You see what I'm getting at? Today's world is so complex, we have abandoned the fundamentals and no longer trust ourselves and our experience to be in control. And it's no different with your health and performance. You see, biology, biological systems, including your body, mind, and spirit, are exceedingly complex, yet fundamentally simple. And all the studies, technology, and expert edicts are not about to solve cancer, diabetes, heart disease, or even COVID. Remember, 15 days to flatten the curve, or Pfizer's "Science will win" slogan as our government contemplates approving yet a fourth booster? But guess what? Getting back to the fundamentals of health will prevent all of these and more. The problem is it's inconvenient. It requires work. Mistakes and missteps and detours are part of the process. There's nothing convenient about facing the fact you are not fit, vulnerable, or overweight. So we sweep it under the rug with the latest pill or procedure, especially when we are fooled into thinking our insurance is going to pay for it. The reality is, you're paying dearly when you go down that road. Our addiction to the consumption of soundbite science, published studies, and hanging our health on the words of the latest online gurus without thought, curiosity, or questioning is the mental equivalent to running into the 7-Eleven for that hot dog, big gulp, and a bag of chips. Meanwhile, we are ceding our own thoughts and experience to these entities, while the conspiracy theory of self, I will also posit that you are also ceding control to a much larger entities who have huge incentives to maintain and grow the medical industrial complex and maximize profit while doing so. This can only be done by preventing you from optimal health, the health potential we all have locked inside us. The corollary being each of us needs to be sick at some level. This is why metabolic health and building metabolic capacity is so important. This is the unseen foundation of health, and it is formed on a physiology where fat metabolism is optimized. Without this, you are eventually going to be recurring revenue stream like most of America. Follow the money. It is that simple, and all the smoke and mirrors and technology and expertise cannot cover up this glaring fact if you are paying attention. Like the athletes I work with, you have to trust yourself. They trust their own experiences from using Vespa and becoming fat adapted, even though it has gone directly against all the science and expert opinions. But in the end, this yielded both the health and performance results their experience told them that were attainable. And it even led to the groundbreaking FASTER study. Sure, it is great to have science, data, and technology to corroborate our experiences, and we are developing this as I speak. But the biggest part of the equation is your own experience and your own mental participation. The data, science, and technology should build the confidence of your experience and results instead of drive it. Heck, I wouldn't be here banging away about the importance of getting fat adapted if I continued to blindly follow the quote-unquote science and expert advice. I trusted my own personal experience and applied my degree in biology following that expert / science-based advice of carb loading, which led to a subsequent epic bonk to start my fat adaptation journey 22 years ago. Trust the experience, and in doing so, you will be in control of your health and performance for that one endurance event which everyone is entered in, whether they know it or not. That's life.